Hey everybody, it's Dr. Christopher Wellwood here at the Regenerative Medicine Institute. I thought I'd like to go over a quick case with you that I had this week, and it had to do with hip pain. Now, hip pain is an interesting problem for a lot of people, particularly because the hip joint itself is actually very unstable and it doesn't like that flexion, so it doesn't like you to bend forward. It actually feels very good in an upright position. So when somebody comes into me and they're actually saying they have hip pain, we have to figure out exactly where that is. Is it coming from the lower back? Is it coming from the actual hip joint itself? Is it coming from the knee? So this young man had come into me and he has been complaining about hip pain that has been chronic and ongoing and has been resistant to treatment, which means he's undergone massage therapy, he's undergone physical therapy. I believe he's undergone acupuncture as well. And he happens to be an EMT. So he's sitting a lot all day. So after our examination today, I determined that his hip pain was actually coming from the bursa itself. And the bursa is basically a fluid-filled sac that prevents wear and tear. So if this is a muscle if this is a joint and then this is a muscle on top of a joint, the space in between is actually filled with fluid in a sac, like a little baggie. And that fluid-filled sac prevents those things from rubbing together and causing a lot of pain. But when you're sitting for a long period of time and you don't get to move it, that means that fluid-filled sac becomes inflamed, it becomes engorged, enlarged. And oftentimes, over a period of time, it becomes so enlarged that it puts pressure on those nerves when it's stretching out, and that causes localized hip pain. And you know that that is a problem for you if you push on the outside of that bone, kind of on the upper leg, and if you have a lot of pain and tenderness there, that could be trochanteric bursitis. Another thing that we found out with this young man is that when we did an examination on him, we do what's called a telescoping test. So we actually pulled it back and forth, and then we did a grinding test to see if he actually had any arthritis. Luckily, none of the arthritic tests were actually positive, and oftentimes those are positive if you have grinding sensation when you're walking, a deep gnawing pain, or sometimes sharp and stabbing sensations as well. His was more of like a pressure and achiness when he would go from a sitting to a standing position. He would start to walk, which means that he had some inflammation in there. So what we ended up doing for him is, instead of doing prolotherapy, which we can do, or PRP, which we can do, we ended up doing prolozone. The benefit of prolozone with those larger joints is that because we're using a gas, it will actually expand and it will encapsulate and encircle the joint to the point where it bathes the area in oxygen, and oxygen being the stimulator of stem cells. It also happens to reduce inflammation. So instead of using an ultrasound as well as PRP and prolotherapy, we did a non-ultrasound guided injection using prolozone. And luckily for him, after those two sets of injections, the bursa as well as the actual joint capsule itself, he got up and walked without any pain at all for the first time in a very long time. So just thought I'd go over a very brief case with you today. I thought it was very interesting. I know we're going to have a couple of more patients who are actually traveling very far to see me, a couple of hours for the exact same thing. So I'll give you an update and let you guys know, just as I always do, and see how these cases go. This is Yours in Health, Dr. Christopher Wellwood at the Regenerative Medicine Institute.